So hi everyone, this is Nikhil Torsakar. Today we are talking to Bob Reeder. He was a patient who had come in for treatment. So today we're just going to talk to him about his experience, the improvements he's noticing in his quality of life after the treatment. So Bob, if you could just go ahead and introduce yourself.
Okay, my name's Bob Reeder. I'm from a little small town in Ohio called Ann Arborton, Ohio. I'm recently retired. I did work in the electronic industry most of my life in service, and had some health issues.
So you mentioned that you had some health conditions. Could you elaborate a little bit more about the conditions you had, the diagnosis you had received, the symptoms you were experiencing, and how it impacted your quality of life?
Okay, my health issues started with COPD, which is, there's no real cure for it. So after extensive testing, going to different doctors and having different opinions on what I could do, basically the only thing that was left was for lung transplant, which is a pretty tough thing to go through. So I thought I'd check some other avenues. So we started to look at some stem cell treatments and started doing extensive search through pretty near every state that had it.
Can you tell us a little bit more about the options that you had tried to manage the COPD?
After my local doctor recommended I go to Cleveland Clinic, I became part of their lung replacement program, which is a 2-year program with extensive testing and thorough lung treatment that they could do for me. And there's 3 options you have. They have the lung replacement, you have lung where they just cut out part of your lungs that are bad. Then there's a lung where they put valves into my lungs. So we went through all that to where I decided not to do the lung transplant. They couldn't do the lung reduction program because there wasn't enough good part of the lungs. So it come down to putting in what's called a Zephyr valve. And what the valve does, they go down through your throat and they put valves into your lungs so that lets the air out so that you can get more air in to breathe. And what happens with COPD, your lungs don't have enough elasticity to push the air out. So a lot of people think it's because you can't catch your breath, but actually you're full of air and you can't get any more air in. So the idea is to push air out. So these valves were to go in and constantly let the valve air out of that lung so that I could breathe. Well, when I went through that procedure, they determined that there wasn't enough good function in the lungs to put these valves in. So basically there was nothing else they could do. So that's when we turned to stem cells, because it was another option, about the only place I could go to see if it could help. So with extensive search with my daughters, we had a place in Cleveland, Tennessee, Florida, Arizona, Chicago, and Deborah was one that I kept in constant contact with. And she constantly made contact with me, emails, texts, and finally I decided to go out and have the treatment.
Can you talk a little bit more about the process in terms of did you go to social media? Were there any websites?
Basically, it was all new to us because there wasn't a lot of research that we could find other than by Google. So every place that they went on, they caught a hold of the place, the hospital, the doctor, whoever was in charge. And it all kept going back to Deborah. Just seemed the most professional, the most knowledgeable, and explained the operation, the procedure more. They use your bone marrow and using your own stem cells versus stem cells from umbilical cords and all that. So just from all the information we gathered, and we just decided that Geo is our best option.
Is there anything else that stuck out to you? Was there anything in particular that you came across that differentiated from some of the other centers that you had looked at?
Basically, it was just the professionalism and the knowledge I received when I contacted you guys. Not that the other places weren't, it seemed like we all, no matter what new place we got a hold of, and we discussed it, and we always went back, and it was kind of convenient because my daughter lived there too, but there was a place just in Cleveland, which is close to home, that we thought, well, that's close, I wouldn't have to travel, but I just felt that this was my best option.
Can you talk a little bit more in detail? And yeah, Deborah, she's a great member of the team, very knowledgeable, very personable. So we're very fortunate to have her. Could you tell us a little bit more about sort of the nature of your conversations with Deborah, like in terms of, her knowledge and how she answered your questions, if you could just also just the level of follow-up that you had with her that impressed you about, her overall approach.
Well, her knowledge of the company was the best of anyone I'd talked to. And anytime I texted her or emailed her, it was within seconds to minutes that she called or emailed me back. There was no, 3 or 4 day wait. And any question that we had as far as, what I'm going to be like before the surgery, after the surgery, what the, the downfall is, what could happen, what might happen, the day of the surgery, what we're going to go through, what they expect us to do and when to be there. And it was just, the information was overwhelming that I felt when I got there, I knew what I was going to do and have it done. And actually, it even went better than she explained.
A lot of our patients actually are coming from different parts of the country, sometimes parts of the world. I mean, we've treated patients in Europe and Africa. Can you talk a little bit more about sort of the process leading up to the day of the treatment in terms of, booking hotels, in terms of, just how did they sort of help you with that process in terms of, arranging your stay and arranging the procedure the day of?
Okay, well, we'll go back a little bit in time. I got the stem cell treatment last October. So in the summer of that year, I was in the hospital 3 different times with what's called exasperations, where I couldn't get my breath. I had to be admitted to the hospital, put on steroids, hooked to breathing machines, but because I just couldn't handle it. And finally, on Labor Day of that year, I went in again and I said, listen, this isn't, there's nothing else they can do for me. So at that time I said, listen, when can I get in? I want to do this. I wanted to see if it's going to help me. Days that I called her, we got the first available time to get in, which is October. Gave me easy directions to get there, and it helped. My daughter was from Chicago, so actually she came out to visit me. We rode out in the car, so there was no airplane travel at the time, and then got a hotel. The night before the surgery, we stayed at a hotel which was not even a mile from where we did the surgery, and which made it convenient.
That after the Staybridge Hotel?
Yeah, that's it. Yeah. That hotel right there. And because she dropped me off and says, I'm going to find out where it's at. And she came back. She goes, Dad, it's 2 minutes. So we don't have to get up too early in the morning to be there. So that was convenient. We went in. The treatment went perfect, and we was out of there by noon. And then I went to her place and stayed and come home the next day. I flew home with no complications. And since that time, I swear to you, I've never been back to the hospital. I've had no exasperations. There's still times I'm short of breath with activity, but not like it was before.
So that's incredible. I'm so glad to hear that. Can you talk a little bit more about the actual facility? Because people, I think, really want to get a good feeling about what the actual center of the facility looks like.
Okay, yeah. Like I said before, I stayed very close, a few minutes away. So we pulled in. It's a very, very new building. It's a professional course that they have there, concourse for buildings. Went in, or met right away at the reception desk, taken over to the preparation room where we went paperwork and went through all the necessary needs there. Prepared the preparation room for the surgery was right just down the hall from there. Had people with me the entire time, the doctor, the nurse, and went right down to the where they did the procedure at, because it's all in one floor. It's convenient, you're right there, and then after the surgery, they put you in another room, and it's all within, 10 to 15 steps of where you come in the door. So everything's, there's not elevators, there's not rooms, and you got to hunt where everybody's at. It's one floor. It's very, very professional and very clean, and very simple to get to and in and out of. Okay, well, my daughter went to the recovery room. They said to wait until I got done, and the surgery took a lot less time than what they'd said, which was nice. We went in there. She was shocked to see me. She thought something was wrong because I was back so soon. But no, we sat there and I was in no pain at all. Just a little sore where they went through. And they said, what do you want to eat? And we said, well, I don't know. So we ordered breakfast from, I don't remember the name of the place, but my daughter, it's one of her favorite places to eat. So they brought us breakfast and juice and coffee. And we sat in there until the stem cells were ready. And, just like sitting in a little hotel room with a TV. and ate our meal, and they put the stem cells back in, and we were out of there. Very, very, very nice.
Yeah. Did you get to watch Netflix? Usually people like watching their favorite entertainment or listening to some music. I don't know if that was...
I think I might have turned it on ESPN just to catch up on the sports for the day.
Tell me a little bit more about the actual process, because obviously, people hear bone marrow aspiration. It's a little bit, can be a little unsettling when you think about drilling in the bone, but...
Oh yeah, it was, I had gone online, of course, to prepare myself for bone marrow, and I didn't really understand how it worked until I went through it. Now, was I shocked? Yes, I was. I'm not going to lie and say it wasn't, because you're awake the whole time. So you're not under, and you don't have to worry about going under anesthetic and coming out of it. So there is some level of pain, but nothing that you're going to not be able to handle. It's just they numb the area and they go into your bone, the hip bone in the back. So I was laying face down, and just kind of as they went into the bone, there was a little bit of discomfort, I'll say the least. But it was a very short period of time. It just until they got into the bone to get the marrow out. And actually, the little bit of pain that you do have, it's a short period of time, and it doesn't take that long, and you're done. For a couple of days, it might have been a little tender, but it didn't hurt to sit down. It didn't hurt to go to the bathroom or walk or get in the car. So there was no long-lasting pain from that. This is April, and I had it in October, and I can tell you each month, even my family and my friends acknowledge to me that, hey, you look better, you sound better, you feel better, you're moving better. And it's nice to hear from someone else, because when you feel that way, you don't know what other people saw before and what they see now. So
I'm so glad to hear about how your condition has improved since the treatment. Can you talk a little bit more about maybe some of the things you're able to do now that you weren't able to do before, like in terms of activities or just general mobility?
Yeah, like my grandkids are growing up now, and they play sports, so I don't miss any of their events, where it's basketball, softball, track, whatever they're in. So a lot of times I had to worry about what school I was going to and where I had to park and how far I had to walk, because I knew that I never had enough energy to get to where I had to go from the parking lot to the school or to the field or wherever I had to go. Where now I don't even think about that. I just say, okay, we're going to this school, and I know how far it is to walk there, and I do carry oxygen with me if I need it. And I'm able to go to those things. I actually golf once a week now, which I wasn't able to do before. It's just a fun league with a bunch of friends, so I'm able to go out and do that, which before was very difficult, and there's a lot of times I couldn't make it through the round of golf. So that was one of the big things that I wanted to make sure I could do, was be able to golf. So I just went out the other day and hit a few, and I was able to do it. So yeah, for me, that's a bonus.
Definitely. It's all about quality of life. You can't put a price on that, that's for sure.
Right.
I was going to ask the question again about like medication or other treatments that you were using before, because some people, obviously they're on inhalers, there's some other medication. Can you talk a little bit more about the medication that you were on before the treatment? And maybe sometimes people are able to, in no way do we say like just get off your medication, because that would be dangerous. But sometimes people do mention that they're able to taper off or reduce the dosage. So I guess it's a two-part question. Is number one, what were the medications you were on before treatment? And then the second question would be, what changes, if any, were you able to make to the medication regimen after treatment? Okay,
before I was on several different I still keep my blood pressure medicine, so that's nothing to do with this procedure here. But I do have 3 different inhalers that I use. One of them's for emergency, so I carry that all the time. Just if I'm exerting myself or need to go a little bit further in a walk, that I just take a hit off of that, just for emergency. I have other ones that I use in the mornings that I used to do every day, 3 times a day, which now some days I don't do at all, and some mornings I might take a hit off of one of them. As far as any other medication, I've kept it the same. I've not changed anything. From my pulmonary doctor, just saying, hey, you're doing good, so don't change anything. You feel good, but if you all of a sudden take yourself off of a medication, then you might start other trouble. So as far as what I was taking then to now, it's basically the same other than the inhalers, but I'm not having the trouble that I was. Before, I was taking the medication and it didn't feel like it was doing any good. So I wanted to go by what my pulmonary doctor said to say, you're doing good, so just stay with it. Stay with what I'm using. So
what were the specific inhalers that you're using currently?
Spiriva is the one I do in the morning, and then Delera, which is twice a day. And he had told me, as a matter of fact, I was at the doctor this morning, and to just check a test I had done, and he said there's another inhaler. It's called Trilogy. It is a combination of those two. He says, but if you're using those two, there's no use switching. So the albuterol is the emergency inhaler that you carry just, for occasions that you need it.
When did you receive your diagnosis of COPD? So I guess I just want to make sure we talk about how long you had been living with COPD.
Yeah, it's been 4 years since I noticed the shortness of breath, and I went to get it checked, and now I'm at the stage. A year and a half ago, I was at stage 4, severe stage 4 COPD. So it just went bad pretty quick. But since then, and since the stem cell, it's stayed the same. It hasn't got worse. Because they told me last spring that I'd went from 40% capacity to 30, down to 20, down to 18, and then I got it back up to 23 and capacity of my lungs. So that was good because it was going up. And then after the treatment, he told me today I was at 25. So, they can say stem cells don't work or they did whatever, but I can prove that it helped me.
Proof is in the pudding, exactly.
Yes.
You had talked about your experience with Deborah, which, very glad to hear. As I said, we're very fortunate to have her. Talk to me a little bit more about some of the other members of the staff.
Oh yeah, she was a treat. I got her laughing right off the bat, and she just loves to laugh. And with myself and her and my daughter, a little bit of time we was there, we had a blast with her. She's professional, but she's fun, and she knows she can make a joke and she can take a joke. We went in there and it was just, we laughed and we kidded, and then Billy called me after the surgery, and then the next week, and I told her she better quit bothering me. I'm going to report her, and she just laughed. So like I said, very, very professional and very fun people to be with. Even though we did do some kidding and joking to decide when it came down to, the procedure and what I needed to do, what they had to do, and what they expected of me, it was all just, very professionalism, very strict on, do this, don't do that, don't worry about this. We got you covered. They talked to you through the whole thing. They didn't give you any surprises on, hey, this might hurt or this might be uncomfortable. And don't worry, we're here. They were both professional in every aspect of the medical field.
How would you rate the medical staff?
As far as rating the medical staff, I would give them a 10 for professionalism and courtesy and respect to the patient.
How would you rate the overall booking process from initiating contact to booking the treatment and then arriving at the facility?
As far as booking the appointment and scheduling and contact with the company and myself, everything was right on par. The communication was email, the communication was text, the communication was phone calls, updated on when I should be there, what time, where I was staying. So everything as far as the scheduling will be taken care of. They're right on top of everything. So as far as the scheduling, I would give them a 10 also.
How would you rate the facility in terms of, cleanliness, in terms of the look and feel, comfort?
As far as you want to rate the facility, when you go there, you don't really, you're not in a hospital. You don't feel like you're overwhelmed with nurses and doctors and bells going off and things over the loudspeaker. It's very quaint, very comfortable. I would rate that a 10 as well, because you're right there with everything's right there where you go.
How would you rate your post-procedure experience in terms of results and how you're feeling on a scale of 1 to 10?
As far as 6 months later to when I had the treatment done, so knowing that where I'm at, I can be able to do things and still participate in family things, events, grandkids. I know that my condition for now is staying the same, and it might not seem like much, but as you get worse in any type of condition you have, it only goes downhill. Where for me, I can't say that I'm better, but I stayed to where I'm at and I didn't get worse. So to me, that was a win-win situation. So I got to give that 100.
Perfect. 100 out of 10. That's not too bad.
Yeah.
What would you say to somebody who is considering stem cell therapy?
If somebody asked me if I had ever had the treatment and what I thought about it, I would rush them to the first place and the fastest I could get them, because it's a win-win situation, because there's no side effects that if it doesn't take care of you right away, there's no, anything you have to worry about there. And the good thing is there's a good chance it's going to help you. So I would recommend it 100%. The thing that really makes it good for me is that I have a great friend base and family base and support crew, and how they've stood by me through the troubles I've had, and just the well-wishers that could constantly see me and say, man, you look so good, and you're acting so good, you sound so good, and it looks like you're feeling good. And it's like when you're sick or you're not feeling well and you have overwhelming support of people that just give you confidence and praise you, it's a wonderful feeling. It is. And it's like, I know how I was and I know how I am now, and I can promise you it made a difference.